Hey, it's Rachel Carroll with the Neuromuscular Studio. I am here again with Eric Christensen of Chandler Physical Therapy. He's a doctor of physical therapy, and he has been on my series of wellness lectures and informational videos this past week, and it's been good.
It's been
exciting.
So
yeah, we've gotten some good feedback. So I wanted to bring you a little bit different content today. So one of the things that Eric always guides his patients through is knowing how to foam roll correctly. Foam rolling is an excellent tool to help self-treat either tight connective tissue or tight muscle tissue to help increase mobility and to decrease pain in between your PT sessions or your neuromuscular therapy sessions as well. Really quick, one misconception, and you'll probably expand upon this as well. One misconception with foam rolling is that you have to do it a lot, and that you have to do it hard, and that you have to basically beat up the tissue. Those are not the cases. So we actually, in my personal opinion, you may have shared the same opinion, we'll find out. But my personal opinion is that it's only meant to elongate the tissue and to make the tissue more pliable. And if you're doing it too much, then sometimes that will equate to more inflammation and more pain. So what I wanted to do was present this information today so that you guys had a little bit more information to how to do it correctly at home. And I asked Eric to do this because I felt like he was an expert and he does this all day long. So without further ado.
Thank you. It's cool. I hope you guys are all staying safe out there for sure. So foam rolling for us, it's amazing that we can get some really good results, and people tend to stick with it when they're doing their home program more than just a passive stretch. It's a little more active involved, and it does involve direct pressure. And as Rachel was saying, it gets the pliability of the tissue movement, maybe increases circulation. Just like any tissue work we're going to do, whether it's in our office or whether it's in Rachel's office or at home, nothing's going to change long term if we don't change the habits that cause that in the first place. So this is a great way to open the window. It's not going to keep the window open unless you do something to offset and change kind of what got you there in the first place. Like Rachel was saying, hard and aggressive foam rolling is not necessary, and it can actually make things worse. My rule of thumb is that if you have to hold your breath or brace against it and can't breathe through it, we're missing the point. You might be able to survive it, but you're missing the point. The goal with this, beyond just a mechanical muscle change, is we're also looking for a nervous system change. Direct pressure to a muscle is inhibitory. It's why it works. It's why massage works. Is because if we get something that's on too tight, if we apply direct pressure, we can decrease that and get better muscle function on that. There's also a principle called reciprocal inhibition, that if a muscle's on one side of the joint, the other muscle is off relatively. So if we have muscle that's not firing appropriately, if we work on the muscle that does something opposite of that, sometimes we can get better firing just because we've changed the tone of it, basically taking the emergency brake off. And so that's really the goal with foam rolling for the most part. We talked, low back pains are going to be very, very common, and you guys might have more of it now than ever because you're doing more sitting, maybe you're working from home, you're not going out as much, you're not changing as many activities through your day-to-day, so that's kind of what we're going to focus on, kind of the lower half, maybe for hip, low back, leg pain, that sort of stuff.
Okay.
So without further ado, let's maybe saddle up through here. Rachel is going to help me be the model, and we'll kind of go through the big four that I have planned out for you guys today. You can get foam rollers pretty much any sporting goods store with that, if they're open still. But Amazon does carry a wide selection. This is a 6-inch by 36-inch high-density foam one. I would say it's on the more firm side. You can go with a lower density one. They tend to be white, and they're going to be a little softer. Or you could take a towel and line it over the top to give yourself a cushion if it's too aggressive. The big muscles we're going to focus on today: your thighs, your quads. And the lateral quad, or what most folks might say is like the IT band region, your glutes, and then your calves are the big ones.
Okay.
And so for the quads, you can either do both or one leg at a time.
Okay.
And to do that, we're going to go kind of army crawl position, foam roll right on the thighs there. And from there, you're just going to be kind of going back and forth. If this is too uncomfortable or you feel like it's putting too much pressure on your back, you can slide so the foam rolls under one leg and have the other leg posted out to give you a little more support.
Like that?
So let's bring this this way, and then bring this more into like a crawl position.
Okay.
There you go.
Like
So
that.
you get a little more support. It might put a little more pressure on that one leg, so if that's too intense, maybe move back to both legs. The distance you travel on the foam roll is not important as long as you get the whole leg at some point. So when you're looking, I tell folks to break it into the top half of your thigh and then the bottom half of your thigh, rather than trying to catch the whole thigh at any given time. And you could do small 2-inch sections, you could do 6-inch sections. That doesn't necessarily matter. You could go back and forth very frequently over it, or you could kind of sit and hold tight on it. Ultimately, that kind of technique is going to elicit the same amount of change. It's just whatever you can tolerate best or whatever you feel like resonates best with you.
Okay.
Yep. Actually, kind of stay in that position because we're going to rotate to the IT band area next.
Okay.
Okay.
All right.
And a common misconception is that we are stretching out the IT band. That is not true. It takes like 20,000 pounds of pressure to stretch out the IT band. But the IT band is like a sail on a ship. Its tension is going to be dictated by the ropes that tie onto that sail. And the muscles in the thigh tie onto that sail. So if we can put direct pressure on the muscles in the thigh, we can decrease the tone, we can decrease the tension of the IT band. So you get a resulting change in that, but it's not because the IT band's getting stretched out.
Okay.
So kind of similar position. You've got a hip bone right here.
Mm-hmm.
We're not starting on that.
Okay.
We're going just a little bit lower.
Okay.
And we're working down the side of the thigh. I like to be down like Rachel is on her elbow. I feel like I have more control with that. And what I would say, maybe Rachel, take your right knee, bend it over the top. There you go, and
Like
straighten
that?
out your left leg. There
Okay.
you go. And then same rule applies here. Top half, bottom half. Don't feel like you got to traverse the whole length of the thigh each pass. You know, do a little bit and move a little, do a little bit and move a little bit. This will arguably probably be the most sensitive area. It tends to be the most tender. So proceed cautiously. And if you need to back it off or put a little towel or cushion, there's nothing wrong with that. Again, if you're holding your breath or you're bracing against it, you're tensing against that, we're missing the point in time.
It's counterproductive.
Yeah,
Yeah.
absolutely. And for most of these, I'll say, maybe 10 to 20 passes per area at most. You don't have to do a whole lot. Once we get that change, then we want to use it.
And you do want to do bilateral, both
Absolutely,
sides.
yeah.
We don't want to be, walking. The demonstration today will just be on one side, but I definitely want to be even.
Yeah, and if you find an area that's a little more tight, spend a little more time on it if you feel like it's being productive that way. There's no real magic number for this.
Okay.
Next one will be your hip kind of piriformis area.
Okay.
So we're going to sit on the foam roll and kind of turn deliberately onto one cheek. And once you're on that cheek, whichever one you're sitting on, you're going to cross that ankle over the other knee. Now that's going to make it a little more intense. If you feel like it's too aggressive, don't cross it over just yet. And then we are working through kind of the entire glute. And it runs from down here all the way up to the top of your hip bone. So you could roll down a decent amount. There's a lot of territory there to work with. And a lot of times they can be very sensitive, and a lot of times trigger points in the glutes can refer sciatica-like symptoms without actually being related to the nerve itself. So if you're starting to feel some stuff down the leg, that's totally normal. Back it off, let it calm down. But it's likely you've got a pretty active trigger point through there.
Like I do.
And then last one, looking at calves. Calves are really often will get tight when the glutes aren't performing as well because they're adding more to the propulsion when we walk and kind of move. So they often can get tight. I honestly prefer to use a lacrosse ball or a tennis ball, but you can use a foam roll. We'll show that first, and then we'll show the lacrosse ball.
Now, real quick before we get into the calf, can you talk a little bit about, a lot of people like to roll out their hamstrings because they feel like their hamstrings are tight. Talk a little bit about that biomechanics and how that sometimes is a myth.
Yeah, so hamstrings will often get tight, or the perception of tight, because they're hanging on for dear life. And number one, I don't feel like I get a very good rollout with the hamstrings on the foam roll. I just don't feel like I can get a lot of pressure. But a lot of times they are tight because other things are forcing them to work. So when we're looking at rolling out the hamstrings, if we're taking a security blanket away from a baby, it could actually maybe even flare that nervous system up because we're taking that element of stability with it. I would much rather see you reduce the muscles that are pulling you into this position and then activate the stabilizers. And I see that oftentimes hamstring tension goes away pretty significantly.
Right. Yep. Makes sense.
With that. So calves, let's pop one leg up onto the foam roll, and then I like to cross the opposite ankle kind of over where that is at. And you could maybe even bend the knee a little bit, kind of like, there you go.
Oh, okay.
And then same rule applies. We're working, you kind of have an outside calf and an inside calf, so you can kind of turn your toe either to the inside or to the outside to bias that a little bit through there. And some people, this might be very appropriate.
Yeah.
As far as pressure, it's kind of an awkward position. You do not need to hold your hands and hover your butt. Okay, just shimmy a little bit back and forth, inch or two, and then scoot your whole body inch or two there. You can hover if you want to, but your shoulders get pretty tired. It can be
Yeah, I was
pretty
gonna
tough.
say, and then you start recruiting other muscles and not actually isolating and focusing on
Right.
the thing that needs to be rolled.
So,
yeah.
not necessarily horrible, but
Now, people who stand for a living, your servers, massage therapists, everybody who normally is a standing position with their job, this is going to be absolutely 100% something that you need to do preventatively. Also, people that have plantar fasciitis, either currently or have had plantar fasciitis, calves are paramount. Calf tightness is paramount to that condition. Very strong correlation there. So, so foam rolling and self-treating calves if you're going through that is very, very important.
yeah. So if you don't feel like you get good enough out here, you can get a lacrosse ball, tennis ball. Again, Amazon not sold out the last I checked. And we could do something very similar using lacrosse ball. Because it's a little more point specific, it's going to be a little bit more aggressive. So if this is giving you enough bang for your buck, don't feel like you got to do this. But if you don't feel like you're getting enough, please feel free to modify. Same thing, you got kind of an inside and an outside calf. You can kind of play around with foot position. And sometimes the ball just in of itself is going to be enough. You could also cross the ankle over like you did on the foam roll to add even a little bit extra flavor.
Not today.
To that,
Too
with
spicy.
that. So again, and she did a good job of self-regulating as far as like, if you feel like that's too much and you're kind of pulling that face, then let's not do it.
Yeah, that was a 9 for me out of a 1 out of 10 scale when I put that pressure down.
Sure.
This is more like a 6 or 7.
Okay, gotcha. So those are the big 4 that I like to use as far as kind of lower back, kind of lower leg as well. There's lots more to do, so if you do have questions, please message or comment below and we can kind of figure that sort of stuff out. What other questions do you have or any other points you want to touch base on?
What frequency? Like, so somebody who's working out on a regular basis, should they be foam rolling every day? Should they do it before or after their workout? Those are common questions that I get.
I would say if you're following the rules and not overwhelming yourself, a daily routine is great.
Mm-hmm.
And what I like about foam rolling or tissue work in general is that not only is it prescriptive and works on problems, but it's also kind of diagnostic. You can be like,
Mm-hmm.
oh, I didn't know I was tight there, and
Mm-hmm.
kind of work on there. So it might draw your attention to maybe some dysfunction you had prior to even working out.
Mm-hmm.
I'm a big fan of, unless you're going for your 1 rep max,
Mm-hmm.
doing this kind of tissue work before you're working out.
Okay.
There will be maybe a slight decrease in muscle recruitment in the 10 minutes after you do it.
Mm-hmm.
So if you're going to go for the most muscle recruitment you've ever done, maybe don't do it. But I like to think that if we get you more mobility, you're going to move more naturally within that kind of gym session or training session.
Okay.
And that's more valuable to me than if you're doing that. But if you're a power lifter, there is some evidence to say maybe do it afterwards versus doing it before.
Okay.
I don't think this is something, as long as you're guiding yourself and staying within that realm of reason, I don't think you can overdose on something like that in terms of frequency, as long as you're not overwhelming. If you're super sore and you're pushing through it, then yes, you can.
Now, acute injuries, that's a contraindication, correct?
Absolutely.
Like you do not foam roll when you've had any sort of an acute injury.
Yeah, within that, and again, the injury might change, but
Sure.
the tissue healing model, we're looking kind of that 4 to 6 week healing period.
Mm-hmm.
At least in that first 4 weeks, let's approach it tentatively and see where we're at.
Okay.
Post-surgically, kind of really would depend on the surgery.
Sure.
And what you're
And that's what you would guide them in with their PT sessions here.
Absolutely.
When it's appropriate to incorporate foam rolling into their rehab plan.
And it's becoming more widespread now that a lot of people have it, so they're more familiar. It's not like this new thing, like 5, 6, 7 years ago. People are like, what is this? And
right.
now I'm getting a lot of repeat customers saying, oh yeah, I've got a foam roll, I love it. What can I do on it? And
Sure.
now it's more, they've already got the habits in place. It's just guiding it.
So one of my big things, I have a lot of clients that travel on a very regular basis. I'm sure you do as well. Some of my clients actually purchase travel foam rollers. There are small ones that are still cylindrical that are about 6 inches long and they're about maybe 4 inches in diameter that you can put in your luggage. I also have a really small one on my previous video with Eric. You'll see that, but it's a small, about 4-inch, and it's fantastic. You just put it right in the luggage. And then also your tennis balls or your lacrosse balls. Word to the wise, put it on top of your luggage because TSA does not like these. They will open your bags and they will search. So just make sure it is on top. But this will save you when you're traveling. Hotel beds that you're not familiar with, your body doesn't like, new pillows, the travel from the airplane. I have some clients that put it in their carry-on and they actually put it behind to help their back pain when they're traveling or glute pain, sitting on those hard seats. So this is universal. We actually, all of our new clients get a tennis ball, in addition to some other things when they come in for their first session with us. And we teach them, how to do some basic things. But
Awesome.
yeah.
Yeah, I've seen some that actually you can unscrew the ends and it collapses flat.
Oh yeah,
And
those
you
are
can
cool
do
too.
those, or you can unscrew it and like put socks and stuff inside of it.
Yeah.
There's some unique stuff out there these days.
And that's a cool thing too, because it's good that they have those things, because just because you're traveling doesn't mean you stop your self-care.
Right.
That's what a lot of people who travel on a regular basis for work have to figure out, is how do they maintain, their body having less pain with all of those travel issues, and and still progress with what they're doing here once they're at home. So
Absolutely.
yeah.
So reach out, get a hold of us if you have any questions, or if you want maybe some progressions on these things, we'd be happy to tackle those as well. And other than that, just stay safe out there and make sure you're still washing your hands, I guess.
Yeah, and then if you want Eric's information, it's Chandler Physical Therapy, and you're pretty wide open on the net, right?
Yeah,
You're,
ChandlerPT.net is our
right?
website, and then I'm at Chandler Physical Therapy for most of the social media handles. So if you just search for us, we're there.
Yep.
We can go from there.
All right, awesome. Have a great rest of your day, guys.
Thanks, guys.